Okay, our next question is directed to Dr. Palfrey. And another parent from Boston writes, my son has autism and complex medical issues, including chronic eczema and horrible reflux. He also has severe behaviors. Every time I talk to my pediatrician, she focuses on the behavioral issues because he has autism. Since these other issues are obviously medical, why isn't he getting treated for them? We understand there are tremendous challenges facing pediatricians in the current healthcare system. I think that's an understatement. What do you think needs to be done to change the system so that every person with autism will have a comprehensive evaluation that identifies and treats effectively the chronic comorbid conditions associated with autism?
Well, thank you for those. Those are actually two questions. And just very quickly to follow up on the issue of advocacy, in Massachusetts with the Rosie D. case, parents got together, families got together, and we now have the promise, at least, of a much more efficient system, particularly around screenings, and we'll see in terms of treatment and so forth. So keep up the hard work of the advocacy because it's so important. But this first question that you've asked is very disturbing to me, actually, because in child health, in pediatrics, we need to look at the child as a child. And perhaps he has autism, perhaps he doesn't. But if a youngster comes in and has eczema and has reflux, it's our job to take care of those problems. What I think this parent is running into is a situation, and I don't want to point fingers at her pediatrician, but where the training has been inadequate in terms of learning how to talk with the child, talk with the parent, deal with the person as a person. And sure, it is pretty upsetting when the youngster is not easily tractable in the room, is running around, et cetera, and we all can imagine the scene with the charts in the door and all of the issues that are going on. But I see this question as very sad because it means that we're not getting across to our medical home providers ways to deal with this. Now, one nice way to address something like this issue of the youngster with eczema is that, sometimes putting on all the salves and putting on all the things that need to happen is pretty upsetting for kids who have sensory problems and who don't particularly like to be touched, et cetera, et cetera. So some of our pediatricians have figured out ways to maybe write a little story for the child to be read as the bedtime story about the yucky stuff, about what it feels like, before ever going ahead and giving the salves and so forth. So long answer to this question is training. Important for you all to be involved in helping us in the medical schools, helping us in the residency programs. And there are innovative programs where we are having parents and people with disabilities being on faculty, but we need more and more of that. There is no question that there are comorbid issues for all of us. And autism comes with its own particular ones. Gastrointestinal problems are very common. So what we need to do with that sort of second question about the system is that the idea of the medical home is that instead of having a churning healthcare situation, and since you talked about poopies, I will too. The way that pediatricians are now paid is by volume. The more you see, the more you get paid. So it's very convenient to see a lot of colds and poopies, to be, blunt, and have that churning. Well, that's not a healthcare system. A healthcare system is where if we need to spend 45 minutes with a family or we need to spend an hour with a family to really get to the basis, we can do it. And Thank you. Can you do that again? And so on Capitol Hill with Mr. Obama, in every place that we're going right now, that's what we're asking for, is that we have a healthcare system which it gives the appropriate amount of time to seriously take care of people and shift. And there are formulas that we're working with the insurance companies about pay for service and with per member per month on top that hopefully will shift this. And I hope that you'll join with us in trying to promote the medical home idea, because that's really what we're trying to do. Maybe even home visits. Wouldn't that be fun? Okay, thanks.
Thank you very much, and the Autism Society stands with you in terms of this healthcare reform. Right? There have been numerous studies that have been published that show that our community is the one that is the least served of any diagnosed condition. So this issue of healthcare reform is critical to us.